And here we are going to the medication what we use for treatment of cancer. It is called chemotherapeutic agents. Chemotherapeutic agents used to destroy the tumor cell or cancer cell. We also called chemotherapeutic agents antineoplastic agent or antineoplastic. Neoplasia is a cancer. So what are the drug list and for what are the main clue for NCLEX exam I'm going to share with you. It is super important for our NCLEX board. So first of all, the drug names. The list of drugs we use for chemotherapeutic agents or cancer. One is called alkalating agents, alkalating, like carboplastin or cisplatin. Another medication, antimetabolite, is called fluorouracil. Fluorouracil. Anti-tumor antibiotics, named bleomycin. Some medication are plants alkaloid like vinblastine and vincristine. Some are selective estrogen receptor blocker like tamoxifen and cytoxan, right? And sometimes there are two more medication we use for antineoplastic or immunosuppressant like cyclosporine and methotrexate. And let me go explain one by one. So the first one is cisplatin or carboplastin. So the antineoplastic or chemotherapeutic agents have a lot of severe side effect. As a healthcare provider, we must know and we could educate our patient about this medication. Like cisplatin can cause bone marrow suppression. Everybody know that bone marrow can produce red blood cell, white blood cell, and platelet. If bone marrow suppression occurs, bone marrow does not produce enough red blood cell and patient develop anemia. If red bone marrow suppression and does not produce enough white blood cell, infection easily catch up and causes infection, and patient came to you with a fever. So if your patient take anti-chemotherapeutic agents and they have a fever, it indicates bone marrow suppression. Reduce the white blood cell. When white blood cell, neutrophil, macrophage go down, infection occur easily. If the platelet is go down, then easily bleeding occur. All of the side effect of bone marrow suppression, and bone marrow suppression is occur because of anti-cancer medication like cisplatin, carboplastin, fluorouracil, vinblastine, vincristine. So all of them can cause bone marrow suppression. The cisplatin may cause the tinnitus or blurring of vision, okay, or electrolyte imbalance. They can cause electrolyte imbalance. So if you ask me what kind of electrolyte imbalance occur because of cisplatin, they can cause hypokalemia, hypocalcemia, hypomagnesemia, or hypophosphatemia. So the cisplatin basically causes the potassium go down, calcium go down, magnesium go down, and phosphate go down, right? So all of it go down. All of it go down. So I said the medical terminology, the cisplatin cause electrolyte imbalance, especially hypokalemia, hypocalcemia, hypomagnesemia, and hypophosphatemia. So if the patient under threat of electrolyte imbalance is a RN or LPN, what you will do? You could monitor the electrolyte, or fluid intake is very important. Fluid intake needs to be correct 2 to 3 liters per day. So we make sure if your patient take cisplatin or carboplastin, we give them enough fluid for make a balance of electrolyte and check the electrolyte levels, right? So another medication we use called fluorouracil. Another medication are fluorouracil. So fluorouracil also can cause bone marrow suppression. And as I told you, when bone marrow suppression is occur, there are 3 problems. One is red blood cell go down, second white blood cell go down, and 3 platelet go down, right? And another medication is anti-tumor, is called bleomycin. Bleomycin has a side effect cause confusion, right? Or chills. Another antineoplastic medication we use, what are the plants origin are, it is vinblastine and vincristine. So vinblastine and vincristine are the plant's alkaloid, and they easily can produce pancytopenia. Pan means all, penia means reduce. So they reduce the white blood cell, they reduce red blood cell, and they reduce platelet and causes the pancytopenia, because they can cause immunosuppression of the bone marrow, right? And also patient can complain GI upset, means nausea, vomiting, and diarrhea. So GI upset, most common here, and hepatotoxicity, neuropathy, and alopecia. So if you prescribed, or if you see your patient has to have to take the vinblastine or vincristine, you could check the liver function test, because they can cause hepatotoxicity. Another medication we use as a chemotherapeutic or neoplastic, and they are selective estrogen receptor blockers. They block the receptor, right? Mostly you use the tamoxifen. So tamoxifen affect, especially work for the female and affect the women, and causes the patient who take the tamoxifen, especially women, they can cause hot flash or irregular menstruation, also vaginal bleeding and discharge. So this is the side effect of tamoxifen. Let me read it. Increase the risks of uterine carcinoma, another problem, blood clot or stroke, right? And also I told irregular period, vaginal bleeding and discharge. So also it is important that tamoxifen increases the triglyceride and cholesterol level in the body. The patient who have to take the tamoxifen because of their cancer, the side effect of tamoxifen, they increase the triglyceride and cholesterol level. Okay, so now I am going to explain some super important information for NCLEX board regarding chemotherapeutic agents. So like here, what are the nursing implementation? Monitor the patient for potential toxic side effect. So if your patient have to take the antineoplastic medication, we could monitor all of the side effect, right? So side effect during the natal period, and natal period means 8 to 14 days after chemotherapy. Especially some condition, the chemotherapeutic are contraindication. One is the pregnancy. So if the patient is a pregnant, definitely it is contraindication for them. So now I'm going to share some basic information about the chemotherapeutic or antineoplastic agents or medication that frequently asking NCLEX board. Keep in mind, if your patient should take the chemotherapeutic agents, so as a LPN or RN or healthcare provider, we could always monitor the patient body weight. So a client weight should be taken the day of medication administration. So that day you give, that day we measure the body weight. Also, the client should avoid vaccination during the therapy. And medication can cause and increase the uric acid level. So cisplatin, tamoxifen, vinblastine, or cytoxan, cyclophosphamide, methotrexate, all antineoplastic medication, if you give, you could check the blood uric acid level, because hyperuremia is also common. Some client will be given the blood thinner with cancer medication, right? Why? Why you give blood thinner with cancer medication? To increase the effectiveness of chemotherapy. Also use the bleeding precursor. And special, in some medical condition, we need a special handling may be required, right? Like I said, some cytotoxic medication may cause future birth defect, and no pregnant or breastfeeding nurses to care of the client who should take the chemotherapeutic agents. And also, we make sure wear gloves if admin a solid. If applying the cream, I mean chemotherapeutic agents, if the cream form, we wear 2 pair of gloves. Most of the chemotherapeutic agents we give IV, patient can chance to develop extra basation may occur. If the extra basation may occur, we could observe the IV site. And our first priority, we could stop the infusion, and second priority is we notify the primary healthcare provider. So before to finish the chemotherapeutic agents, I could tell you some book mentioning that 2 more medication we use for as an antineoplastic, or we use immunosuppressant. One is called cyclophosphamide. So cyclophosphamide is an antineoplastic agent, also immunosuppressant agents. So what are the basic information we need to know for NCLEX board? First of all, I said cyclophosphamide. So indication of cyclophosphamide are we use. There are so many indication of cyclophosphamide. Cyclophosphamide we use for ulcerative colitis or autoimmune disease, right? So you see, what are the use of cyclophosphamide? Like some medical condition, autoimmune disease like lupus, vasculitis, rheumatoid arthritis, or psoriasis. Also used in the prevention of graft and host disease in organ transplant patient. Example, like a patient do the kidney transplant, and after the transplant, patient develop rejection. In that case, we use cyclophosphamide to reduce the rejection. So how cyclophosphamide work? Mode of action. Cyclophosphamide inhibit the normal immune response by blocking interleukin-2. The most common side effect of cyclophosphamide, they can cause infection because they are immunosuppressant, or they cause hepatotoxicity, means they can cause liver problem. They can cause nephrotoxicity, means kidney problem. They can cause GI upset or hirsutism. Hirsutism means excess hair growth in the body. So nausea is most common. Hemorrhagic cystitis, right, means urinary bladder bleeding. Also, we could monitor white blood cell count because immunosuppressant, they can reduce the white blood cell, and infection is most common, and patient come to you with fever, right? So what are the other key points about the cyclophosphamide? So like we could notify the provider right away for any sign of infection or monitor for liver function, also monitor for the renal function if your patient should take cyclophosphamide. Another medication we use as a antineoplastic or we use as a immunosuppressant, it is called Methotrexate. Methotrexate, right? So Methotrexate, other indication are rheumatoid arthritis, psoriasis, cancer, like cyclophosphamide, right? So I'm saying the Methotrexate may cause the major side effect, they may cause thrombocytopenia. Thrombocytopenia means all cell go down, red blood cell, white blood cell, or platelet. Methotrexate may cause the toxicity, okay? And sometimes NCLEX would ask, what are the antidote of methotrexate? It is called leucovorin. Leucovorin are the antidote. So if your patient has to take methotrexate, we make sure fluid intake is enough or sufficient. Okay, at least to be increased 2 to 3 liters per day. As like as cyclosporin or methotrexate, both cases, or cisplatin, we make sure our patient take enough fluid intake, at least 2 to 3 liters per day. What else? And if I ask how methotrexate can work, methotrexate inhibit the folic acid metabolism and which prevent the cell reproduction. And this causes death of rapidly replicating cell and also has immunosuppressive effect. The most common side effect of methotrexate are they cause infection, they can cause hepatotoxicity, they can cause bone marrow suppression or GI upset. The key point about methotrexate, we notify provider right away for any sign of infection or monitor for liver function, or we can check the complete blood count or CBC level. Okay, and methotrexate we also use to management of ectopic pregnancy. Okay, or the other disadvantage of methotrexate in case of ectopic pregnancy, repeatedly HCG level go up. HCG means human choriogonadotropin hormone, another use of methotrexate.